So today I'm focusing in the first 20 minutes on COVID, where I believe things are going, and I'm basically going to be continuing my analysis of the way in which the disease, as caused by the virus, is moving in different parts of the world. I'm also going to talk about my understanding of how well communities and nations are getting on top of it. And then I'm going to talk a little bit about some of the challenges of knowing what the virus is doing, and also the issues being faced by governments as they deal with the impact of the virus on their people. Finally, I am going to focus on leadership issues that are emerging. I spent a lot of time thinking this through yesterday, and I'm going to offer you 2 or 3 things that I believe are going to be essential as we collectively lead out of it. Now, many of you on this briefing are leaders in your own right, and I hope that when we get to that point, that will stimulate some discussion. But also in our discussion, I'd be very happy to dig into some of the other more precise challenges, for example, whether or not health services or other conditions and other issues can be maintained despite the impact of COVID, and also what are going to be the sort of new thoughts about treatments. There's a big meeting in WHO right now on the research agenda, and I'd be very happy to spend a bit of time, particularly on the treatment side of things, if you want. I will be firstly introducing Peter Morey, who's our illustrator. He's doing a board. He's just the screen spotlighted there, and he will capture our discussion. I'd like to thank so much the team who's been doing the work on the visual live illustration, because it really helps us. I'm going to introduce Durga Saptkota from Nepal soon. I'm going to ask her to give us some comments from Nepal, and also Sergio Machaca, who is a Mexican doctor. I'm going to hear from him as well. Now, as I look at the situation around the world, I want to keep stressing that this really is emerging as a disease that is really profoundly affecting poor people and poor nations. And the numbers of new cases around the world continue to rise, and they are definitely rising exponentially again. I am particularly concerned about the numbers in Southeast Asia, but also the continuing rise in numbers in Latin America. I keep straying, this is not a virus that's everywhere. It's extremely focal in its distribution. And the distribution is particularly profound in urban areas, and particularly profound among poor people in urban areas. The way COVID moves is constantly revealing inequities in our society. Yesterday, I listened to a whole group of representatives of people working in the meat sector describing the growing anxiety that they have that the movement of COVID in meat processing plants is now relentless, and presumably because of a mix of factors, both in the conditions under which people work, but also the conditions under which people live in food processing. This is just a really serious situation, and it's causing illness and death, and not just among the workers, but also in their communities. And the inequities in relation to other areas of employment coming out again and again. I particularly am picking out people who work in residential care for older people, and people who work in public transport and other public services. This pattern of revealed inequities is so serious that I think that we have to keep articulating about it. And so next week, when the UN High-Level Political Forum starts on the 7th of July, I will take part at the beginning, and I will focus on relationships between COVID and people. And I will continue to argue that it's not COVID itself that is the cause of some of the challenges we're seeing. It is just that it reveals things that we probably knew about, but were not holding inside ourselves. And that COVID suddenly brings it out abundantly clear. The food system exists and provides cheap food because of the way in which it basically keeps employees at a very low level of remuneration and requires them to work under really tricky conditions. Ditto with the hospitality industry, ditto with the residential care sector. In all these areas, there are situations which make it super hard for those who work to be able to negotiate a situation where they're not exposed to the virus. So the issue of revealed inequities puts a huge burden on every single one of us to be acting everywhere we are to try to minimize these inequities, even though it feels really, really difficult to do. And I'll come back to that in the leadership segment shortly. Now, in order that people around the world can actually make sense of this virus and hold it at bay by interrupting transmission and also suppressing outbreaks the moment they develop, it's really essential to know where the virus is. Now, understanding where the virus is requires being able to test whether people have got the virus in their bodies, and that means having the capacity to do virus testing on a widespread basis. There is, as I said before, it's becoming clearer and clearer, a global shortage of reagents for PCR testing. Alternative tests are coming through, but they're still under development. And so one of the things that I've been doing, particularly with groups who are trying to seriously to get on top of their COVID, is to think through what are the strategies when you've got really quite minimum testing for you to understand where the virus is. Can you pool samples and therefore end up with a grouped sample? Or can you do strategic sampling to try to tell you where it is? Can you use data from testing indicators to tell you what's happening? For example, if you get a quite high positivity rate on testing, is that telling you that the virus is moving quite rapidly and probably you're underestimating it? All these things are coming clear, and together with a colleague, Dale Fisher, and another one called YY Tao in Singapore, we are beginning to get a collection of indicators that can be useful for trying to work out where the virus is, even when you haven't got detailed numbers. And, you know, that is important. Yeah, okay, Beijing were able in 2 weeks to actually do virus testing on 8 million people in order to try to work out where the virus is. But then you've got other settings where there's just that degree of granularity just isn't there. And you're having to try to work out where the virus is on a lot of circumstantial data. This is particularly the case in Africa. As we look at the movement of the virus in South Africa, we see that it's gone from Western Cape to Eastern Cape, and it's now also in Gauteng in the center of the country. Well, if that's happening in South Africa, you can be pretty certain that the virus is doing similar stuff in other countries, but we just don't have the detail. So knowing where the virus is increasingly now involves making quite careful deductions, not on models, but just thinking, well, if it's in country A, it's going to be in country B as well. But at least we can work out the particular regions and communities that are most at risk. Now, whereas the virus is becoming really important in countries that have managed to get their amounts of disease down and are facing the recrudescences, I don't like that word, but I can't think of a better word. Anyway, the new spikes of infection. So in the UK, the one that's in the newspapers is Leicester, but looking at the data that came from the Office of National Statistics and Public Health England yesterday, there are other parts of the UK that are beginning to see a build-up in numbers of people with COVID. And it won't come through in the data immediately, but certainly in the north, in Yorkshire in particular, there are local areas. And one of the problems in the UK is that you've got two different testing regimes. Pillar 1, which is using tests at formal laboratories, and Pillar 2, which is sort of add-on testing system that was part of the government's efforts to ramp up testing, and integrating the results from the two testing systems and then making them available in a granular way at local level is quite challenging in the UK system. It's also challenging in the South African system. It's challenging in the Indian system. It's not an easy process to develop a very good granular analysis of where the virus is on a locality basis everywhere. But if any of you have got any suggestions or clues as to how we can encourage that better use of local data to help identify where the virus is, and to do it in a way that doesn't stigmatize people. You know, when you get down to having virus details by streets, then immediately that does lead to the possibility of stigmatization. But without that degree of detail, it becomes very difficult to do containment work. And that applies everywhere in the world. So thinking through where the virus is and having data that's useful at local level is the second key thing that I've really felt this week. My third key thing relates to continuing to deal with the impact of COVID, the impact on different communities, the impact on particularly also different ethnicities and also different wealth groups. You see, my big worry that I'm picking up all over the world is that actually the people who are most at risk of getting COVID because of their occupations, because of their positions in society, are now being blamed for the COVID. Migrant workers being seen to be a possible threat because they happen to be people who've been associated with COVID, but the reason why they got the COVID is because the conditions under which they're living, according to my analysis and the analysis of others. But then it gets turned round and they get stunned and shunned and stigmatized and accused of being COVID carriers. Same is applying to some Black and minority people. Just again, look at the UK Leicester example, where the immediate shift in the headlines has been to say, well, sweatshops for garment manufacture in that city that use a lot of immigrant labor are becoming the new epicenters of COVID. Okay, well, you can turn it around that way, but the moment you do it, there are real risks of stigmatization. And it's kind of intriguing to see that similar kind of stigmatization to what we saw on HIV in the early years is beginning to happen on COVID. And I think we have to work on that now to really try to contest it. I am concerned about the impact of COVID on other health services, as I said when we were checking in at the beginning. I'm also watching the impact of COVID on education. I quite understand people in the education sector being worried about the loss of between 6 months and 1 year of schooling because of COVID, quite understood. At the same time, I think that I'm also aware of the need for real delicacy about restarting schools. We've got quite a lot of examples of new outbreaks happening when schools have been restarted. Society will come to terms with many of these challenges, whether it's what you do with schools, what you do with sporting events, what you do with pubs and restaurants. These are going to be difficult. But at the same time, what I want to keep doing is trying to avoid the discussion ending up being health versus the economy, or dealing with public health versus employment issues. I also want to stop people saying that as soon as you get spikes, you then need to lock down again. No, I say, your spikes tell me that you've got to have the capacity to close down outbreaks. You close down outbreaks by being really good at interrupting transmission. Interrupt transmission by finding people with the disease and isolating them, finding their contacts and isolating them. You go through that so that it becomes a really regular ritual of life. And you build that in to everything, every single activity. And you say that is what being COVID ready is all about. And that's how we prevent the need for just reacting to everything by immediately saying, right, we're going to lock down, stop all movement. And then you create that terrible sense of real disenchantment and disenfranchisement among particularly poor people who just feel they're being jerked around. So dealing with the impact of COVID has to be from not just a public health perspective, but a human rights perspective and an equity perspective. And I want to build that in. So these are my three just constant refrains in my mind. Number one, COVID's revealing inequities in access to healthcare, inequities in how we live, inequities in our ability to negotiate better working environments and so on. It's absolutely essential for the COVID-ready life to know where the virus is and to be able to make really quite sound local decisions based on that information. Number three, when kind of looking ahead and looking into the future and thinking about the impact, it is absolutely essential to make certain that there's an equity focus on the impact and that we go beyond the health sector to other sectors. So you might say to me, who's going to do all this? Where are the leaders who think like this? Where are the leaders who are prepared to put people first? Where there are leaders who are prepared to focus on equity as an essential part of the future? Are they in business? Yes, in some cases, I think they are. Are they in civil society? Well, certainly they're in the trades union movement, and they're in the International Chamber of Commerce. They're in quite a lot of the organizations that are working for the future, where there is a perception that you can't actually plan for the future, living with COVID life, without having a focus on equity built into leadership. Of course, it gets tangled up with party politics, but working to try to get equity built into development, built into governance, is not in itself a party political issue. And I suppose the first thing I want to say about the kind of leadership that I think we need to advocate is that we've got to be allowed to talk about equity without immediately being labeled with some pejorative epithet that then means that we can't be involved in the debate about values and then about how those values are expressed in what we do. Because it's values that have to define leadership. And if your values are going to say equity matters, whether it's on any attribute, on sex, on wealth, on ethnicity, on geography, or nationality, I don't mind what particular set of values you're bringing in. I just want to keep sort of finding the space where we can focus on equity and introduce that value system into decision making without immediately getting, you're a progressive, you're a radical, all that stuff that then makes it very hard for you to be taken seriously in discussion. So that's my point number one on my sort of leadership bubble. My second point on the leadership bubble is the absolute need for us to continue to be able to make sense of this virus and what it means for individuals and for societies. I can't think of a better word than sense making. It's a pair of words, really. I can't think of anything better, but it's the words that I want to keep saying. And so I'm going to go on saying them for the time being, because sense making is never a single process. You don't suddenly have light bulbs going off in your head on tricky issues. I mean, in my case, at least, recognizing that we cannot possibly help the world to cope with this virus without having an equity lens, and then having had that equity lens without actually bringing that into every single decision-making forum, even though it feels profoundly depressing because so much seems to be stacked against us. That sense of sense-making has been really important to me. And it doesn't mean that every day is good. I mean, there are some days when you sense-make and you still feel absolutely awful, particularly early in the morning. So I want to encourage everybody to be okay and comfortable that sense-making is an ongoing process, key to being able to express your values through leadership. The last point is on the leadership pattern is just quite simply, this virus will not be pushed back and kept at bay through constant competitive behavior between those with jurisdictions over different institutions or communities or even nations. I mean, it's blindingly obvious that this virus, which of course doesn't vote, as I've said a few times before, just simply has a really wonderful time moving around when there is political discord. Quite simply because the only way humanity will deal with this is through a sense of unity of purpose, which then leads to collective action. Now, every single part of this, making sure the values are right, getting the sense making right, and then trying to find ways to avoid fully competitive behavior in leadership. And by the way, in parentheses, I mean the kind of behavior where people just simply won't work together because they're in competition with each other, period. Simply that thing that we see so often in companies, in national government, in local settings, even in our families, just we won't work together because we just don't like each other. So dealing with that is huge. So what are my thoughts about this, just reaching the end of these opening remarks? One, we have to be overt about the values that underlie the leadership that we are seeking to offer. Values matter. Number two, we have to be patient to recognize that different people move into spaces where they're ready to rethink things and try to make changes at their own pace, and trying to push them too hard, trying to force them into different ways of thinking just doesn't work. We have to be able to feel the rhythm and to move with people at their pace and to meet them where they really are and to understand their perspectives. And so that sense making is really a very much more delicate task than simply just saying, okay, you want to think about it, I'll give you a bit of time and I'll send you a few papers to read. It is being ready to exchange, and to exchange in a way where the other can say, you know, I'm not so sure that it would be such a good idea for me to be having my 25th birthday party and inviting 100 people along and doing it and just saying, to hell with all this physical distancing. Perhaps it's not so wise after all, you know. People rethink. So the sense-making part and how central that is keeps coming back. And then the dealing with the competition part is I think, probably the tough one that lies ahead. And we've talked a few times on these briefings about ways of working with people to directly address the corrosive effects of competition on leadership. So finishing this, where does it leave me and my feeling about what I want to do, and where might it leave you? Here are 5 things to take away. Number 1, having a clear narrative about what's happening, or a storyline, or just words to describe it is terribly helpful. Paul Garner, who's been on some of these briefings, by developing a narrative about the lingering illness associated with COVID, has actually joined a number of others as part of a movement for supporting those who've had long-term damage as a result of their COVID. Super important and relevant to the lives of hundreds of thousands of people. Narratives matter, first point. Second, making sure that our connections are strong, because the new leadership patterns will not come from bosses, they will come from us, from our peers. So networking ruthlessly is the key. And each one of us has to be super comfortable about just letting our networks open and grow. And recognizing that if you bring new values to your leadership, it also gives you new reasons to open connections with people who perhaps you hadn't been working with before. Through these briefings, I'm reconnected with many people that I haven't been linked up with for years, and I'm meeting loads of new people. And that is great, because by ruthlessly networking and so on, we are able to have new connections. So then that brings to the third thing, which is recognizing that we are seeking to stimulate new forms of leadership. So we are nurturing the emergence of these new forms, knowing that we can't direct it. But when we see people who've got amazing potential, we're just simply saying, great, go for it, do more. It's not much more than that, you know. If somebody is thinking, is it right that I step out and take a risk and do talk to my local legislator, or do get involved in union activity, or do work with my university, or do try to get into government to work for greater equity? It just sometimes is great if somebody else is saying, hey, wow, I'm glad you're doing that. That's all it needs. But that is the nurturing of the emergence of new spirits. Fourth, I don't think this works if we, at the same time, shy away from standing up for our values. There's nothing wrong with, even if you're quite a wealthy and well-to-do person, as I am, for you saying, well, actually, I believe that poor people should not have to be working in situations where they're at risk of disease. So I think having the values out on the front and having them open, not feeling that you have to apologize for them. I'm sorry, but I've got to go back. You don't have to say I'm sorry. Just let us recognize that the people who are getting this disease are the people who've got the least opportunity, the least room for maneuver, standing up for your values. And then perhaps most of all, that this kind of work becomes relentless. Once you are inspired to work for your values and not to stop because you're feeling the pain of the system that is failing so many individuals and communities, you can't stop. And there is, I think, a particular anxiety that some have, that once people are driven with this energy, they may perhaps sort of burn out. They might put themselves at risk, or indeed they might actually even put others at risk by not being very tactful on when they call them out and describe them and so on. I mean, you know, people are taking risks when they are pursuing values of equity and justice. So I think avoiding destruction is also quite a useful part of the overall toolkit of the new leader who's going to be really like many of you and others, because it won't be the new bosses who do this. The bosses are stuck in the system. It's going to be people who are probably on their way. And while you're doing it, just keep yourself safe and healthy and well, and avoid being targeted and destroyed if you possibly can. So those are my 5 things as I finish. Having a narrative, a clear narrative, being able to repeat it, terribly helpful. Being ruthless about your networking, because connections are everything. Nurturing the emergence of good ideas by supporting others who are doing it. We need to support each other, and the nurturing process, we often need to be cradled in beautiful, comfortable settings so that we can build new emotional connections. Standing up for our values, because values matter so much. And then doing everything possible to avoid damage to self and damage to others, because it's not easy work. So thank you very much indeed. I'm enjoying so much relating with you. We will do open online briefings in the current series. I want to keep saying that again twice next week on Tuesday and Thursday. Then we're going to have a bit of a break while we rethink how we do it, and then we'll get back to you explaining how we'll go on. In the meantime, I just want to say that as well as doing this work on COVID, we're increasingly involved in thinking about the future of food. And one of the things I will try to do, particularly in any briefings that happen after our July break, will be looking very much at the future of food in the time of COVID. Our team, all here just to introduce some, Twee Nguyen, who is the head of our communications group, who's just spotlighted herself, Thuy. Just thanks to her for linking us with the illustrators, but also for continuing the work on videos. we're going on with the music videos and other such things that we talked to you about before. John Atkinson here, just to introduce John. Catherine Deland and Julian Delamonte are busy on other things. I'd like to just welcome Magali Mahdi, Florence Lasben, who's our managing director, and then my brother William, who's also here on, who's helping us a bit with quite a lot of issues to do with business. I'd like to go straight to Durga Saptkota. Durga is joining us from Nepal. There you are, I can see you, Durga. And you, I know, are working as a One Young World ambassador. Just tell us a bit about how things are going, and particularly COVID. I'll give you about 3 minutes, and then I'll interrupt you if you've gone on much longer. Over to you.
Okay, thank you so much. Unfortunately, I missed the previous briefing sessions due to my university schedule, and I'm very glad that I could connect today finally. And thank you for this amazing opportunity in having me. Hi everyone, and namaste. This is Durga Saptkota from Nepal. By profession, I am a nurse, and now today I represent the Karma Health, where we are working to ensure universal health coverage. And for that, we are strengthening the local government. And I'm one of the One Young World Fellowship, just Dr. mentioned. And before and amid pandemic at Karma Health, I'm supervising to achieve universal health coverage for sexual and reproductive health. And we are working in every possible way to strengthen the local government. And because like I belong I'm supervising the sexual and reproductive health, I can reflect something on that dimension. During the COVID management, I can see that no gender lens has been applied in the COVID management, and the vulnerable population are not in the priority, or let's say they are not in the center of the COVID management, and due to which it is clearly evident that pre-existing gender inequality has deepened more. One example I can share is during this pandemic, here we have 30 mortality due to COVID-19, and during 3 months of lockdown, there has been around 39 cases of the maternal mortality alone during the lockdown period. And when we reflect, the first case of COVID mortality was the 10th day postnatal mother. And there are so many cases of domestic violences, partner violence, and the cases of the suicide has so heightened. In last 3 months, around 1,400 suicidal cases has been reported, and same goes with the the rape and other issues of the violence. And I will be really glad if doctor could reflect on in long term what could be the strategy in which we can convince the policymakers in realizing the importance of women's health and maternal health in building more sustainable and healthy community.
That's really important. Thank you very much indeed. It is absolutely astonishing how COVID has led to the deepening of inequities associated not just with women's health, but women's human rights. And in particular, hearing from others in your country and in other countries in the region, it's been really bad. I think the first thing that I have to ask you to do is to continue what you are doing, which is using data whenever you can get access to the numbers to make the point that this kind of situation is occurring. Thank you for bringing out the mental health challenges, particularly the so-called suicide. I mean, it's really important to get case studies of what has actually led to women taking their lives and the particular pressure that they're put under sometimes. Also, the domestic violence situation. I'm hearing from all over the world of the increases in numbers of people who are violated in their homes, but obviously it's women and also children. And then we must push for services to be maintained, not least because in many settings, it's only through being able to access services for sexual health, reproductive health, that women are in a position to actually share and confide the difficulties they face. And that in turn, though it's never easy, can lead them to getting some support. With colleagues who are on this call, we've been working to try to get hotel owners to establish proper refuge for people who are violated. Durga, we have colleagues on this call who I think would like to connect with you, and just to invite, I mean, it may be that you know them already, but I'd just like to offer my colleague Marianne Hasselgrave just a moment just to completely connect with you by verbally now, in case you haven't connected already. So Marianne, would you like to say a word to Durga, please?
Yes, thank you very much, and thank you, Durga. What you're saying is proving what I've been hearing. And David, is there any way that there could be a small subgroup where we can talk together about issues around sexual and reproductive health and rights and how it's been affected?
That's great. Twee, can we not now, but at some point, could we try to see whether or not that would work, or is that not going to? What we were thinking is that we could stimulate a group to form. We just put people in touch with each other, and I think we will do that. And our approach is generally to try not to get ourselves caught up in the middle, Marianne. So we will do that now. We will we will think about stimulating a subgroup to work. Thank you very much. Thank you, as always. Durga, we will come back on this issue. Twee has put a note in the chat, thank you, Twee, about how that subgroup might form. And I just want to make one other point, Durga. There are quite a lot of people on this call who have worked in Nepal or who have knowledge of Nepal. And I would encourage anybody who wants to be in touch with Durga just to put an email address in the chat box. Thank you very much indeed.
Thank you so much for this. This is the absolute pleasure, and I will love connect to in future. Like,
thank you. No, we do that, Durga, and we will make sure. I will make sure that we stay in touch with WhatsApp or everything else. And here we've got other people writing in with email addresses. There are two Florences on this call. Florence Egal, Florence Lasben. Thank you, Florence Egal. And thank you also for Iman Ahmed. Iman is in Cairo at the moment, but she's looking very focused on Somalia, and she's just written a comment as well. Thank you so much. And if Durga, if Joe Nichols gets in touch with you, just to tell you that she, who's on this call, is looking at all sorts of issues that picking up concerns are from women, and particularly poorer women in the area of Somalia and that part of Kenya as well. Joe, welcome to you. Thank you. Chris Langdon, I wanted to hear from you. You and I have said, you know, are we going to be offering spaces in which the new forms of leadership can emerge? How can we nurture that emergence? What are your thoughts on this, please?
Good morning, David. I'm Chris and I'm based in London. We like cartoons and illustrations. Let me just try and show you our book. I'm not trying to flog the book, but just to show you our concept of a lot of current leaders. There they are, blindfolded and unaware of what's going on. We don't think they're blindfolded out of anything other than choice. Our key message is the conformity that got many current leaders at the top precludes them from understanding the world around them. Whenever we use the word conformity in business conferences or conferences with civil servants, there's always a nodding around the room. This sense of why it is leaders have shut themselves down, they've siloed problems, They don't, system thinking is just too complicated. So one of the reasons why we have great affinity with what David is doing, and also his colleague John Atkinson from 4SD, is thinking about new forms of leadership. And I just want to just agree with the points, your 5 points you were making now, but just make a few nuanced differences. This idea of narratives, we think, is incredibly important. My background, I've worked in the civil service, but also in journalism, and I'm working with a colleague, Nick Gowing, who was a BBC anchor. We're really interested in the power of story, the power of narrative. And the question we're discussing at the moment, whoops.
You all right, Chris?
Can you hear me okay? Because my screen has gone blank, but I'll carry on without being able to see your face, David. Not just narrative. Can you hear me okay?
Yeah.
Good. So I'll carry on blind, so to speak. It's not just the power of narrative. I think that's really important, but it's what goes beyond the narrative. What happens next? How do you help people on the journey of change and self-change, and how they change the way they lead? In our view, yes, we think bosses do have a role, because I think some leadership has to be empowered by those at the top. But we absolutely agree with you. It's about leadership also from the bottom, and how one facilitates community-led leadership engagement. We believe, as you do, David, that everybody is a leader. And that's the one way that we start to foster new types of leadership, rather than assuming it's just the classic leadership. You talked about ruthless networking. We think networking should be relentless. What I think has to be ruthless is thinking through the ideas that come from it. We have, I think, an extraordinary opportunity in this crisis to rethink issues value-based, to do with climate, biodiversity, as well as all the critical health issues you talk about. So how we do that process of focused networking is absolutely critical. Values are very important. We've been very excited by, of all places, how the British Academy is now world leading on issues of purpose, people and planet, with some really concrete ideas which are persuading a lot of people in high places of the value and importance of a real importance of social purpose. We think that's absolutely critical. And your final point is about burnout. In a lot of the places I work, they tend to be the open-minded organizations bring us in. They're the ones where we discover that a lot of the colleagues do have issues of burnout. So you as a doctor can talk better about this than I, David. It's a problem, I think, in the medical profession. How you help good people look after themselves, how they change themselves as they help others to change, because there is a risk of burnout, because we're going to go through extraordinarily difficult times, as you've described. So it's how you help those, the coalition of those like-minded leaders. We work with a lot of young leaders. Young leaders are critical in our work, but how you help leaders as they go on what is going to be an incredibly demanding journey during the whole of the 2020s.
Thank you so much, Chris. Chris's book is called Thinking the Unthinkable. He held it up, but you probably couldn't see the title. I couldn't. I'd like Chris to put, there we are. Chris, put it up once more, because we just highlighted.
I'll drop it in the chat as well, David.
Yeah. I mean, because these people are communicators, Chris and his colleague, Nick, it's actually an easy read. I just tell you that as somebody who struggles with writing. Thank you, Chris, and thank you for very much giving us this extra dimension. Many, many things in what you said that I think are helpful to all of us.
And also your colleague John as well, I think has been a real leader in this field as well.
So John, do you want to quickly just say one word on what we've heard from Chris, please? John Atkinson.
Okay, just press all the buttons and get me back in. No, brilliant. And this idea of forming a story that helps people make sense of what goes on is so important, because people are doing it anyway. And if they do it with poor data, with deliberately bad data, with people who are trying to manipulate situations, it's so hard. So this idea that we can create a sense and an understanding of what's going on is really important for us to influence, because if we don't, it's going to happen anyway, and it will take us in directions that aren't necessarily so helpful. Thank you very much indeed. I'm so grateful for this use of the word story. Storytelling suddenly becomes really, really important and valuable. Joe Nichols wanted to make a comment on what's happening in Somalia.
and it's slightly disturbing. I think you should say it though, Joe. I think it was on.
Yeah, no, I mean, there's a couple of things that have been really surprising in the past couple of weeks. I mean, one is actually the number of people coming across the border from Ethiopia, over 50% of people who are saying they haven't heard of COVID, which is greatly surprising, especially because even people in camps for displaced people seem to have heard more often of COVID than that number. So that was a surprise. But the point I was making in the chat was that Somalia has one of the highest rates of female genital mutilation in the world anyway, with about 98% of girls between the ages of 5 and 11 being cut or mutilated. But that's reported to have gone up, which is astonishing in itself, during the COVID outbreak. And the cutters, which are usually older women, are now going door to door to cut girls behind closed doors, partly on the basis that it gives extra time to heal because they won't be out in society. So, I mean, that is such an alarming sort of piece of information, but it does seem to be backed up by a lot of different bits of data. So it seems to be correct.
Thank you very much indeed. Really important and horrible. Thank you. And Joe, thank you for the other point about people coming over from Ethiopia into Kenya or into Somalia, not knowing much about COVID. I wonder what that means. Thank you for continuing to share me these reports of what you're picking up, particularly through chat shows and so on. Really helpful. I'd like to go to Sergio Machaca. Sergio's a respiratory infection doctor from Mexico. And we talked last time about just how tricky things are in Mexico. And I'd love to hear from you what your feelings are and any reflections on what I just said. Sergio.
Thank you, David, and good morning, good afternoon, good night, depends on where you are. I'm also a One Young World ambassador, and I've been working in public health in the last 5 to 7 years, and lately at my postgraduate program, which is respiratory medicine at the National Institute of Health for Respiratory Diseases here in Mexico. And basically what I want to highlight, or what I want to talk about in my experience working with the pandemic, has some points that have been already noted, but I think they are really, really important in our situation here in Mexico. First of all is like the fact that we've been working for 4 months already over the clock with these patients and with this emergency. And it has been like a really interesting process of learning through experiences and through new evidence that has actually make us see different impact in the outcomes that patients are having. Like the difference is like huge to see right now, like the outcomes we're having with the patients, that are more people being extubated and less people having dying from the disease than before. So all of this has been something like really, well, that's made an impact in ourselves and in the way we are working as medical doctors, and the way the health system is actually working, because with all the need of using personal equipment and the high risk of infection, like a lot of processes have been changed and have been going through well, this kind of changes that I believe are improving in many ways. The other 2 points that I believe are actually really, really important is one about also the inequities and the shortages that we have in our health system. This is something that is going on not only here in Mexico City, but actually in our national level, in which a lot of new hospitals or clinics that have been reconverted to attend this kind of patients have been in the necessity to hire new personnel, all nurses, medical doctors, etc. But they haven't had the opportunity to hire like a specialist in the area. I mean, most of the people they are hiring are general practitioners which don't have the experience or the skills to attend this kind of patients. And this has been a really huge challenge for everyone, because it has made the social system, the social health system, to try to capacitate them, like, or train them like in a really short amount of time, which has also resulted in really, really big difficulties for the attention of these patients. And finally, I would also like to talk to you about the problems with mental health that I see that Durga talked about that, and I'm going to talk a little bit about this, but in the health workers situation. The amount of work, and not only physical work and mental work, but also emotionally work that we are facing has given us like a huge quantity of co-workers and colleagues facing anxiety and depression disorders. And lately, what is like the most worrying for us is the burnout, which also was mentioned before, which it has been like the most difficult part to try to make better in the attention that we do to all the COVID-19 patients, because like right now, I believe around 50% of my co-workers, including me, have been working with burnout, and like affecting directly and the decisions we make and the way we treat all the other patients that we are receiving. So I believe that this is especially like the most important, or like the most worrying thing in the health system we need to start tackling, and to start like working in solutions for make all the health workers like be better for giving a better attention. So
we'll focus on that, Sergio. We will pick up on this issue of limiting these destructive tendencies, burnout. We will work with you directly on this, something that particularly interests me. And just going to get one or two other comments, then I might try and come back to you before we finish, Sergio. Thank you very much indeed. Thanks for joining us. Please keep the comments coming in on the chat. And I think, you know, everything that Sergio said interests me, but I do want you to hold on to the fact that they are developing new procedures, which is improving outcomes. I'm hearing this from all over the world, and I think this is a great sign of cognition within the whole healthcare system. Congratulations, Sergio, and sorry it's so late at night. Could I just go?
Thank you for the invitation.
Thank you. FawziaRasheed. Fawzia, thank you for joining us from Aga Khan. If you're there, you wanted to say something a little bit of just going to the question of building a granular picture of what's happening with the virus, what's happening in the response. And you've got some thoughts there that I thought others might like to hear. Fawzia, please.
Well, thank you. Well, in the environments that myself and colleagues are working, testing is not an option, not going to happen anytime soon. And the basis for most detection is obviously presumptive diagnosis. Now, we see an opportunity, but a lot of problems to work out around this too, of using community health workers who are, you know, in communities, going door to door, know their people, are trusted, are instrumental at raising awareness and behavior change, all of which are strategically perfect for COVID and down the line. So while they are well positioned, and if we support them well, they can do the work, there are two issues. One is protecting them, because this far they haven't been prioritized with PPE. Many of them are still volunteers, which has to change. And there was a very useful webinar that AMREF held in terms of the African continent and what's going on. And the AU are pumping a lot of money in terms of supporting, I think it's another 1 million, if not 2 million, on top of those that are already existing for Africa. So people are seeing this as the way to go, but it needs to be accompanied by proper salaries, proper protection, proper professional support. When you speak to community health workers, they will add another dimension of first of all, if they're providing the, standard prevention messages, in many of the instances that they work and the poor that we're talking about, we know that the poor aren't able to act on any of these measures. Water may not be available, etc. So on. So there's that, which is dispiriting. The second is if they identify cases, there can be a lot of negative consequences beyond stigma. And one includes, because it's a notifiable disease, and even if it's based not on a test, but on presumptive diagnosis, in some instances, the government requires mandatory quarantine and in state-run facilities, which are horrendous places and people try and escape from. So, to add, insult to injury for the poor, these are, if you can't expect the poor can act on the prevention, if once you identify disease, you add to their misery, it puts CHWs in a very difficult position. So just down the line, though, this is not going to go away. It seems worth working out how to empower CHWs to do their job safely for them, but also to think through supportive measures for the community so that you're not alienating them. But if you find a case, that there are ways to support isolation and food provision and all of the other things that need to go with it in a humanitarian and a way in which allows people to be willing to come forward and self-identify their problems. Thank you.
Be contacted about this, Fawzia, if people. Sure. So your email into the thing. Fawzia, I've worked with now for quite a lot of years, and the way in which she just described the conundrum facing community health workers has been something that I have heard about as well. And this is super important. Thank you for making that point. I've got two people, and to our last point now, last little segment, two people who have written about narrative, and I want to invite them for 30 seconds just to open their mics and say something about it. First of all, Karen Wiedenmeyer, Karen, and then after you, Holly Wheeler. And we do have to be short because we've run out of time, but I really want to hear from you. Karen, what is your comment on this? It's really interesting if you could share it.
Yes, thank you very much, David. I think what these points that you mentioned this morning, and particularly the narrative that we need to come up, I think this is really key to be able to have an impact in the community. I just tell you a little story, an anecdote. I was in the bus last night coming back from work, and I was one of the only ones wearing a mask. Yeah. And I was looking around and thought, and it was pretty crowded, and I just thought, what would I say to someone who looks at me in a kind of suspicious or maybe, I don't know, in a negative way? And the first emotion I had was anger. You stupid guys, why are you not wearing masks? But that's not the way to do it. We need to have a good, engaging, positive narrative way to talk to people who don't really fully grasp the situation. And I just don't know how to come up with such a story, that is convincing.
Hold that, because that's what we very much were working on with WHO last week. I don't have any answers, but I agree with you. There's simply write off people who have a different view doesn't get us anywhere. Holly Wheeler, could you just build on what Karen said, or just on the note that you put in the chat? Holly Wheeler.
Morning, everybody. Good to be here. The thing that I was thinking about is that it does build on what Karen said, is that the stories that we share, when we share them, we need to be in a kind of receptive space, a space to let the way that it impacts someone else impact us, so that we're open to change, because otherwise we're just trying to influence people from our own agenda, and that doesn't build a connection or a coalition. So there's something about being really core to your values, but understanding that one of them needs to be a kind of openness to engage other people when you share stories.
So therefore narratives have to be co-created and not simply dumped on people. Is that your point, I think, or part of your point?
Yeah, and that they're iterative. By engaging with other people, they grow.
Thank you very much, everybody. Could we go to Peter Morey and just see the screen up so that we can all see how he captured what we're doing? There we go. Wow. Thank you again, Peter. Everybody.
Thank you very much. Thank you for having me. A very valuable discussion and a pleasure to capture. Thank you.
And everybody, I didn't bring in all those who put comments up, but just think that it is so rich to have the opportunity from time to time to share issues that take us from looking at a virus and a disease through to thinking about what this means for the kind of leadership that is needed for the future, and have many stops on the way. We've been joined by some fabulous practitioners who are themselves involved in multiple activities. It's very good of you to give up so much time. We will, as I said, have another one of these next Tuesday and another one next Thursday. Keep using the chat, stay in touch. And if you ever want to be connected with anybody else, just connect with Twee or myself, and we will find a way to make that possible. With this, I thank the whole team. I particularly thank Florence Lasben for the production function, and wish you all a really good rest of the day. Thank you.